Welcome back to Wound Dressing Categories with Lizzie. This week we have a very unique category of odor-eliminating dressings. This category is not really thought of that much because it's a secondary dressing and it's only addressing wound odor. I often wonder how many clinicians lost their sense of smell during the COVID-19 pandemic and no longer have the capacity to even assess wound odor. However, these dressings are always used as a secondary dressing. They're not going to be a primary dressing, and they're used to mitigate the smells that wounds can have. This is particularly important in patients with oncological wounds, such as fungating tumors, where odor can be significantly impacting the patient's quality of life or their care team and causing some distress. Odor could be from anaerobic or aerobic bacteria as well as necrotic tissue. There's two main players on the market today, with one of them being kind of new. So the first is activated charcoal. That's been around for a while. It absorbs the odor molecules to mitigate the smell. An example of this dressing is like Carboflex. The newer dressing to the market is Cynasteam, and this is a secondary dressing made out of cinnamon. And it not only absorbs the odor, but it also releases a more pleasant odor then of the cinnamon. I think it's important to know that if your wound has an odor, that you need to address the source of the odor as well. If it's bacteria, please use an antimicrobial cleanser and or dressing as your primary dressing. And if the wound has a lot of necrotic tissue, of course, you still have to debride the wound in order to address it. So if odor persists beyond that, you can use an odor-eliminating secondary dressing as mentioned. Be sure to like and subscribe to the Frank and Lizzie Show for more details.